Hi, I've got a patient here not doing so great. I mean, his obs are more frequent because he was a 2, so I went to the vitals, and now they're down. He's not so well. I mean, I haven't got the exact figure in front of me, but they're definitely red.
Right, well, what would you like me to do? What did he come in with?
I think maybe a review. I mean, it would be great if you could get here real soon. I'm not sure what he come in with off the top of my head, sorry.
Oh, I'm actually really busy, and I'll try my best.
Okay, Ward 3 surge. Thanks.
So what do you think about that for a spot of poor communication? We all know that healthcare is a complex business and that it's vital to get the necessary information to the right people when it matters. Using the ISBAR tool is the best way to ensure that the right information gets through. So in this video we are going to look at the ISBAR tool, understand when it can be used and see how effective it can actually be in practice. Because communication, clear communication, really does count. And it counts when you're handing over a patient or when you have concerns about a patient, and especially when your patient appears to be deteriorating and you want action taken. So what does ISBAR stand for? It stands for Identify, Situation, Background, Assessment Prompts, and Recommendation Response. And the ISBAR is a clear, structured and shared framework for relaying important information. The kind of framework which would have been really helpful for that nurse before she picked up that phone. So let's see how it might work in practice by seeing what happened to Amy when she came onto her shift. Here's Amy. She's been rostered onto the night shift looking after 3 surge ward. She'd gone through her normal routines and had noticed that Tane's EWS on the previous shift meant that his observations had increased in frequency. When she looked at his notes, it was clear that his blood pressure had been 91 with a heart rate of 40. And Amy knew from her EWS card that Tane's EWS score was a 2, so she understood why he was being observed every 2 hours. Then it came time for Tane's next observation round, but when Amy took his vitals, she noticed that his BP was at 85, but his rest rate was less than 8. Tane was in the red zone, with an EWS of more than 5. Amy knows to act now. She looked at the EWS pathway and yes, a score of more than 5, which Tane had, meant that Amy needed to inform the nurse in charge and notify the house surgeon and registrar. Tane was deteriorating, and it was up to Amy to communicate that to the house surgeon and registrar. So let's see how that conversation went, shall we? But hang on a minute. For ISBAR to be used well, Amy needs to spend just a few minutes gathering some relevant information. Gathering this information means that Amy is going to be able to communicate clearly, using a structured framework to share vital information and get actions taken for her patient. So let's see what information Amy has gathered this time. 1. She knows the admitting diagnosis. 2. She's got the OBS chart with her. 3. She's checked the fluid balance and lab results, and she's aware of the medications chart. She's prepared, so let's listen to how that conversation goes this time.
Hi, I've got a patient here. Their early warning score is more than 5 and the vitals indicate that he is unwell, so I'm thinking you might want to...
Stop! Amy was so well prepared, but now that she's on the phone, she's not communicating clearly at all. Let's go back to that call.
Hey, I'm sorry, I didn't catch your name.
Amy, I'm Amy.
Okay, Amy, let's use ISBAR now, shall we?
Now, that prompt was great because the ISBAR communication tool is going to give this conversation the structure necessary to get Tane the help he needs right now. So, she's been reminded about ISBAR. Let's see what a difference that makes.
Right, sorry, yes, I'm Amy McLeod. I'm a nurse on 3 surge. My patient is Tane Williams. He is unwell. He's 55, male on Ward 3 surge, admitted 3 days ago.
And his consultant?
Yes, his consultant is Mrs. Johnson.
And there's your I, identify. Now let's hear the S, situation.
Well, the problem I'm calling about is that his vital signs are showing an early warning score of more than 5.
Okay, go on.
Actually, I believe it is urgent because he has a low systolic blood pressure and his rest rate is less than 8.
Well done, Amy. You knew it was urgent and you said so, and you gave a really clear reason why. Next, B, his background.
So the patient is 55 years old. He was admitted 3 days ago. He had a history of 4 days of influenza-like illness prior to coming in. He was admitted to 3 surge with diagnosis of left lower lobe pneumonia.
Medication?
Yes, we commenced him on IV antibiotics and IV fluids.
Any past history of respiratory illness?
No, nothing on his record, but he is a smoker.
Now Amy shares those all-important assessment prompts. Remember, these were what led her to make the call in the first place. So let's hear the A.
So his early warning score is 7. I just took his vitals and his blood pressure was 85 and his rest rate of 8. That's down from his last OBS 2 hours ago, and he's not on supplemental oxygen.
And notice how Amy stated the patient's EWS, rest rate, and the change from the previous assessment. Well done, Amy. Now let's hear her recommend a response. R.
He needs a review as soon as possible.
Well, there's Amy's recommendation, right? Perhaps not, because a patient at that level of deterioration needs an urgent review, and it needs to be within the next 15 to 30 minutes. ASAP just doesn't cut it here. Which is what Amy realised when the house surgeon failed to attend because they didn't think it was important enough. And that led to Tane heading towards imminent collapse, and Amy having to call 777 code blue. Perhaps instead, Amy could have emphasised the urgency again by saying,
The patient is rapidly deteriorating. I'm requesting an urgent review. It needs to be done within 30 minutes.
And let's have a good look at that statement. See how it's clear, structured, and shared. Well done, Amy. So let's just go through ISBAR again, and remember this is a communication tool for all handovers of information between yourself and other health professionals if you are at all concerned about your patient's status or needing to communicate information about their status in any way. I is identify, you and your patient. S is for situation, the purpose of your call or conversation. State it. B is background. What's happened so far? A is assessment prompts, the vital signs. And R is recommendation response. What's happening now and what do you want done for your patient? Be clear in your instructions and specific in your timeframes. So this video has just been a short exploration of the ISBAR tool and why it forms the bedrock of great communication in all sorts of healthcare situations. Use it daily and make it part of your communication toolkit.